Hey friends, what's happening? Big dog Ethan here, and I have my good friend Shareef. And so, Shareef, I never personally asked you for your last name. It's a Shareef Snuggs. That's what I see a lot on
Yeah,
the. All right, Shareef
yeah,
Snuggs. I love that
yep.
name. So so Shareef, I heard about you. And boy, my voice is I'm just still kind of recovering from a bit of a cold here, but I first heard about you, first met you through Jean, through our work in March for Medicare for All. She was working with me to try to get more students involved in advocating for Medicare for All. And she had told me, hey, you got to talk to Shareef. He is an awesome guy. He's brilliant. Yeah, just she had a lot of great things to say about you. And when I was talking with her about trying to get more students involved in this effort to, advocate for Medicare for All, um, she had we come up with this idea. Hey, maybe we need to have we need to sort of have someone give a basic explanation of the policy Medicare for All itself. Because here's the deal. Even even with me, I have a dumb loudmouth college kid's understanding of Medicare for All. So taxpayers pay the federal government some money, and that allows the government to set up a universal healthcare system, and it will all somehow cost less than private employer-provided health insurance, and also somehow be more effective than that system as well. I'm mainly such a strong supporter of Medicare for All because it seems most similar to the more effective healthcare programs in other developed countries, according to the studies done by the Commonwealth Fund in August of 2021. And hold on a second. Nope. Hold on a second. I got to do some tech stuff. There we go. Sorry, I forgot to hide that before we started recording, but that's no biggie. So anyways, that's just my understanding of Medicare for All, despite, having done actually a lot of work to advocate for that policy. So I just kind of want to ask you first off, can you give us, I guess, the audience or the listener or the viewer, or even, this is my stuffed tiger Hobbs that I had since I was a kid. Anyways, give us the context out of which Medicare for All has appeared. Could you first explain to us how does our current healthcare system work?
So, to give some little bit of context, so we actually already have Medicare. Medicare covers about 40% of Americans. So when people say Medicare for All, we're asking for the same system, the same program, and give it to the other 60%. So that 40% is the older folks. The folks are getting 65 or older, and that accumulates about 40% rather of the population. So when people advocate Medicare for All, we already have the same system. Just give it to the other 60%. And some people like me who advocate for Medicare for All, I'm acknowledging it isn't enough. So even when we do get Medicare for All and we widen that gap from 40% to 60%, Medicare is still not a perfect system. It's a terrible system. You ask a lot of older folks and ask how they feel about Medicare, they'll tell you that it's terrible. They do not like it. We already have two bills already, one in the House and one in the Senate.
Oh, there is one in the Senate.
Yeah,
I didn't know
yeah,
that.
Bernie,
Okay.
Bernie has his bill, and Jamila Jayapal has her bill.
Gotcha.
And typically, how it works, both the House and the Senate will have similar bills, and they'll get to some point where they'll have basically a negotiation about that bill. Like there's going to be some wiggle room about what do you want and what I want, and they'll meet in the middle. And that's generally the nuts and bolts of it in regards to how our legislative branch works. Like that's how any bill gets passed. You always going to usually see both the House and the Senate will have their own variation of that bill. Gotcha. And that's what that bill is. So anyone who actually has some basic understanding of Medicare is the exact same service just expanding it. What I advocate for is a single payer system that's free at the point of service, so
Mm-hmm.
that we can get rid of the idea that the profit motive from our health industry. That's our current healthcare system in itself. We
And
don't
and
have a system.
yeah,
You got it.
yeah. Just want to hop in there real quick. Explain what is the problem with our profit motive, like with the profit motive in the healthcare industry. What is the problem with that?
Well,
Yeah.
I'll give you an example. So I did an action Saturday, um, at Kingsbrook Jewish Medical Center in New York City. That hospital is closing, and the reason why that hospital is closing is due to funding. Not enough people are going to that particular hospital because they can't afford to pay for service. So we don't have a system that says we're going to keep this hospital open because the community needs this hospital open. They're going to close this hospital because there's not enough people going to that hospital. Ergo, it doesn't make money, so we close it down. So they're comparing our healthcare system is compared to a bakery. If that baker is not getting enough people to come there and buy bread, guess what? That business owner who owns that bakery closes shop and they move on and find something else to do. Our healthcare system works the exact same way. And when you explain that to people and break that down, some people disagree and said that's not true. And other people understand that we do live in a capitalist system. And capitalism says, full stop, that if you don't make money, you don't have a business. That's as simple as that. It's just nothing else to understand. The problem is that we need to get other people to recognize the problem in that, why that's an issue. Another thing I address is that 18% of Americans live 10 miles away from their local hospital, 10 miles. And then most people probably would say, well, 18% is not a big number. That's really not big. It's not 100%. It's not 70%, 18%. Well, if you do the math, we have about 330 million Americans that currently is alive in this country, right? That means that if you do the math, that means 60 million Americans live 10 miles away from a hospital. Now, we're arguing about COVID and hospitals being overcrowded. Well, they wouldn't be overcrowded if he wasn't closing hospitals. And he wouldn't close hospitals if hospitals actually made money. But people can't actually afford their medical bills. They can't afford treatment. They can't afford to even go see a doctor. Most people like me. I work for a living. I get my health insurance from my job. I actually pay my monthly bill for Blue Cross and Blue Shield. But guess
Hey,
what? If
well,
something's
not same really. I'm not. I'm a mooch of a 21-year-old college student. My parents, but anyways, but I am on Blue Cross Blue Shield as well. But
so if I go to the doctor and it needs something seriously done, guess what? I can't afford that. I
yeah,
just can't.
yeah, it's no, you're absolutely right about that. I think, and what I'd like you to do now. So I think you've done a good job of explaining just why our healthcare, at its core, why our healthcare system at its core is ineffective. That was the next question I was going to ask you, and you ended up. So thank you for that. Now, how? Give us a context on a global scale. How are other countries handling healthcare, and how successfully are they doing that?
Well, on a global scale, a lot of people would argue that, let's look at the pandemic for this perfect example, that all other places got hit with COVID and left a lot of deaths there as well. And of course, you're gonna, not to be a doomsday person, some people, inevitable, some people are just gonna die from any pandemic. You're gonna have that. But what you don't have in other countries, you don't have the absurd amount of people are dying of COVID like you have in the United States. Our numbers are far worse than most places, and that's just math. That's just due to the fact that we just don't have a system that says, "Hey, if you're sick, come to the hospital. We're going to take care of you. Don't worry about it." Other places do. They just do. They just have that system in place. It's just not rocket science.
Mm-hmm.
If you have friends and family that are in France, that are in Russia, that are in the UK, that are in Cuba, that are in other places that have a single payer system, a Medicare-For-All system, and you ask them how did they handle COVID, and they're going to tell you that much better than here. It just will, and it's just due to the fact that the profit motive. It really comes down to, like, if you ask a lot of folks here, we wait till the last minute to go to the doctor. We just do. We just don't go because we're afraid of the bill and how much it's going to cost us. In other countries, that fear doesn't exist. It doesn't. Even in Brazil, I have comrades that are from Brazil, and keep in mind, we shit on Brazil, but they're smart enough to realize that we got to keep, the working class healthy. We don't do that here. We just don't. So we will talk about how other countries just treat COVID or treat health. Just keep in mind that the citizens there, they don't think about, well, shit, I'm not going to go to the hospital today because I can't afford it. That doesn't even happen. That doesn't exist. Medical bankruptcy doesn't exist in other countries. It just doesn't. Sure, people can't afford certain procedures. That's everywhere. That goes without saying. But medical bankruptcy is not the same thing if I can't afford a hospital visit. It's not going bankrupt. People go bankrupt in this country, and that's something that we need to discuss.
And so bankruptcy is just not a problem in other developed countries where they actually have like a universal healthcare or just some right. An objectively better healthcare system. This is a problem that is unique to the United States alone. So I think you've done a good job of laying where the U.S. is right now in terms of healthcare, and especially in regards to other countries. So Medicare for All seems to be proposing a universal healthcare system, or sort of like a reinvigoration of the Medicare system to turn it into a universal healthcare system. So you may have already explained this before, but I'm looking at this question again. I just want to make sure that I kind of get this really like hammered in this interview. How would Medicare for All work? How would it be funded? Like what can people expect to be paying for Medicare for All?
Well, to be fair, you're already paying for it, and also too, the government can afford it. It just can't. When we have this argument about how you're going to pay for it, the government just prints money whenever it wants. It just does, and people need to recognize that. Like, if you look at how the United States, the amount of money that it gives to Israel, the amount of money it gives to other nations, and it funds war. We have I think the last bill that Congress passed was like $36 billion that went to Israel, something absurd like that. So we have the money to pay for it. We actually have the infrastructure to do it. We just don't want to. And so you have to ask yourself why we don't want to. And it's simple. It's because Big Pharma and the insurance companies, health insurance companies, do not want you to have it because it doesn't fit their bottom line. It doesn't. It's a simple calculus. Yep. They don't. It's not about the profit of the government. It's the profit of the insurance companies, the profit of Big Pharma. They don't make money if you're healthy. They just don't. So you have to understand, you have to get into your understanding that A, we can afford it. B, the government can build an infrastructure that goes beyond just giving people Medicare. We can do a single payer system that's free at the point of service. You can go to the hospital, give people their medicine, and cover it. And the problem is that we're afraid of the word socialist because we're talking about socialism. And we already have a social democracy in this country. And when you talk about that, people don't understand that. They don't know what that means. They was like, what are you talking about? Your fire department is socialist. Your police department is socialist. Your library is socialist. Your guardsmen is socialist. The fact you have teachers are socialist.
Yeah.
Everything you get already that is free is socialism.
Yeah.
Full stop.
Free at point of service. Yeah.
You went to high school. Your parents, if you didn't go to private school, your parents did not pay your teacher for you to learn. Right? You didn't pay the police officer when you called 911 for help. You didn't pay the fire department. You didn't pay the library. You didn't pay for the parks. You didn't pay for any of this. Where's that money going? Parks are not cheap. Yeah. They're not.
Yeah,
right?
and Yeah, and
Who
just
paid for that?
and just also double back on your point about school, because I think this is one that, like, I think a lot of people who are against universal health care don't realize is that we do the same thing with schools already. And some people would say, oh, like, no, like, that's not, like, you're not, that's not an effective way to operate schools. But I can tell you this, that, like, so I grew up in a district where we actually had a pretty good public school, to the point where, yeah, my parents were, they're pretty Catholic, and they wanted to send me to a Jesuit high school, and I was down for it because, Jesuits, they have a decent secular emphasis on secular education, so I was okay with it. But the public school there that I could have gone to, like, that was already paid for with my parents' taxpayer dollars, was so good that it at least made us stop and think about, hey, maybe should we go to this private high school that's, like, super well renowned and super a well regarded school, or do we send them to this public school? Like, public schools can be that good, and public services from the government can be that good. And again, I think I mentioned this earlier with you, the Commonwealth Fund study that showed empirically our healthcare system so they did a study with 11 countries. It was a lot of, I think that Australia, New Zealand, and a few European countries in the United States. We ranked, like, flat out 11th out of 11th on 5 different metrics. Or I think it was 4. Let me pull it up real quick, actually, now that I'm talking
We definitely spend more money. We definitely spend more money than France, the UK, Cuba, I believe Australia. I'm not sure, but most countries we spend more money on health insurance, or more on healthcare than most countries, and it's baffling, especially like a place like France where everybody is covered. Even in Germany, everybody is covered, and we spend more money. Yeah. So again, it goes back to the fact that we don't want working class folks to have healthcare. Yeah. And I have a very nuanced conversation about that. And when it comes down to it, the reason why your government, big pharma, and the health insurance lobbyists don't want you to have healthcare is simple. If you have your health, you have your wealth, right? You can't punch up at the establishment if you don't have health, right? If you're sick, you're dying, you're not able-bodied, you're disabled, your health insurance is tied to your job, you're not going to quit, you're not going to do a general strike, you're not going to lash out and talk back and have something to say against the ruling class. You're just not going to do that. You just won't. I promise you. People just don't. And because you don't have healthcare, if you look at France, people always talk about we got to be like France. We'll never be like France because they have their healthcare. Those activists, those organizers, those unions, those lobbyists, not lobbyists, but those workers, they are fearless. And the reason for that is if there's something happens to them, they can go to the doctor. They don't have to worry about paying for it. It's covered. We don't have that here. We just don't. And so it sounds conspiratorial. It's not conspiratorial. They just don't want you to have it because at the end of the day, it energizes the left. It energizes the working class. You are emboldened to fight for more. Think about it. If you got health care, it was like they give you an inch, you're going to take a mile. So if I got my health care today, fight for 15, fight for climate change, and it just keeps moving the goalposts. You have more things to fight for now because now you won that battle and now you have your health. You can ask for more social inequities. They don't want you to do that. They got to cut this one. If you get this one, it's over for them. It's not. They need to hold on to this. They have to. They will lose either way.
So I definitely like what you're saying about Medicare-For-All for sure. But I almost want to like sort of do like a quick turn in this discussion here. Tell me about can you think of any cons to this system to Medicare-For-All specifically? And I'll get to why I'm saying Medicare-For-All specifically because I'll just say it right now. There's a guy who's running for U.S. Senate here in Arkansas. His name's Dan Whitfield. He is running on universal health care, but his plan is called Healthcare for All. And so I wanted to ask you about that, but specifically with Medicare for All. Would you say, can you think of any cons to this system? Are there any downsides to implementing this system over, say, even just a public option like what Biden, initially campaigned on and then just abandoned after, like, I forget how early it was, but he abandoned public option pretty soon. What are there any cons to this system that you're well, not that you're a proponent, but like that we're talking about, that we're advocating for?
Yeah, Medicare for All, or Medicare, is very limiting. You don't get all the bells and whistles to your health when you have that. If you ask anybody who has Medicare, they will explain to you that there are still other fees, there's still other services that it does not provide. Medicare it's more of a, like, think of it more like a taster or an appetizer to a main course. You're not getting everything in Medicare. You just don't get that. You just don't. There's still other things you have to pay for. If there's an emergency, if you get cancer or any other forms of treatment, they don't cover everything. So Medicare is just a baseline service. And so the problem is Medicare in itself is primarily tied to income. And we have to remove the idea that when someone gets sick, they have to worry about how much it's going to cost them. And the question shouldn't be about how much it's going to cost. It says how much it's going to cost us not to have it. That's the problem. We don't have that conversation because we live in a society that is only individualist. We believe that if you're sick, it's your problem. You did it. It's your fault why you can't afford your healthcare. I have some friends of mine, I have some members of my family that really believe that. They feel that, listen, if you have an issue with not being able to pay for healthcare, get a better job, work harder, work smarter, go out there and pull yourself out of bootstraps. And that's the problem. The only advantage, the con is that we have to get more Americans to deprogram ourselves of how we think about health and how we think about each other. We don't have a sense of camaraderie. We don't have a sense of loyalty to our countrymen. We just don't. There's no statesman anymore. There's no one here who believes that we should work together and that one person's problem is everyone's problem. That's really the problem. That's really the downside.
I want to bounce off that. Yeah, I want to bounce off that too, because I've been thinking about this a lot too, in terms of like working together. And I was talking to you earlier about like truth and comedy. I have a background in improv, and so I'm all for working, together with people, but I also want to make sure that I'm working. Let me get my mouse out of the way there. But I also like working towards, I want to be sure that, you're working together towards good ends, right? Because if you think about it, we have a lot of corporate Democrats and Republicans who are like, oh, hey, let's, they celebrate working together, being bipartisan and all that stuff, but it's really to give like, a bunch of like corporate bailouts and that sort of thing, and not, not carry out any kind of policy that would help working class citizens who are, who like objectively now have less wealth than the top 1%. I think that was a report that came out. I first heard about it in Bloomberg. I think they were citing some kind of study from a federal agency. But anyways, I want to pivot now to another thing, because I know you probably got to get going here in a few minutes. The first thing is, so I want you to expand upon March for Medicare for All, because I guess whenever I first called you, I thought you were still part of March for Medicare for All. I guess you're telling me now that you're not. So did you have to leave the organization out of, was it just disagreement with the strategies they were using? Was it more of just a personal reason why, or just talk about that a little bit?
No, not at all. I don't have a problem discussing that. So a lot of issues that I have with March Medical is a lot of issues that I actually have with the left in general. We on the left, we eat each other. We're not like the right, where that they work together on a particular issue.
Yeah.
We just too much infighting on the left. I don't care if it's the March for Medicare for All. I don't care if it's the People's Party, the Green Party. Our Revolution, DSA, Socialist Alternative. There's so many different groups on the left where we don't come together to fight fight on a common ground. And there's just way too much disagreements. And so for me, I'm a Medicare-For-All healthcare activist absolutist. If you're somebody who's going to fight for healthcare and you're going to go all in, if you're not a racist or an asshole or someone who's just not going to just be completely like off the rails, I'm going to work with you. I don't care about your policies. I don't care about other issues that I disagree with. I don't care about how you work or your strategies or whatever. If you're in community and you want to be helpful and you want to be involved and you want to actually get shit done, I'm going to work with you.
Yeah,
I just am.
I love that attitude that you were carrying there, Shareef. So I'm going to say one last thing, and then I guess I'll let you go real quick. So I know I mentioned Dan Whitfield. You're talking about someone working in the community, sort of trying to form coalitions. And yeah, I've been hearing a lot of talk about that as well, and I fully agree with that sentiment. I want to show you someone named Dan Whitfield. So I had him on my radio show about I guess it's over six. I had him on at the end of July, so I guess that's about 6 months. And he actually showed up to the March for Medicare for All protests. So I had him on the day after that because he had agreed to do an interview. And as it turns out, I sort of hashed this out with him in the interview. He's actually running on his own version of a universal healthcare policy called Healthcare-For-All. And he was, I may splice something in here, or I may just even say, I may just include a link to the interview. But he was basically actually outlining on average how much people can expect to pay in taxes, with his plan. And it's a plan that would also include some of the things you were talking about with the downsides of Medicare for All. So I don't know what do you have you heard of Dan Whitfield? What do you know? Would you be willing to consider other universal healthcare policies going on in the future?
I would actually.
Yeah,
I would. We at the March for Medicare for All, because I actually still collaborate because I'm very collaborative with everyone. We actually have a UN filing campaign.
Yes.
And I don't know if you saw the link to that.
Yeah, and actually, I was accidentally displaying that. So I said at the start I was on I was accidentally displaying a window, and it was actually the petition, this very petition you were talking about. It's kind of formatting weird on here, but yeah, talk about it, please, while I kind of scroll here on the left.
Yeah. So one of the things that we're asking for, we don't have a bill or anything like that, but one of the things that at the march and the other activists who kind of helped us put this together, we're asking for cradle to the grave. We're even putting funeral costs. We're putting every minute thing you can think about. We're saying that we want to take care of folks from the time they're born to the time they die, even funeral. And a lot of times you don't hear in Medicare for All Health, we're talking about preparing for someone who's going to die, showing that actual respect to someone's human life, even at that point. And so I'm all for if anyone wants to help reimagine, reshape, because we have the beauty of not having a healthcare system now. We can reshape, reorganize, replan, and strategize how we want that system to look like. We should be having these conversations. We should be discussing we can't afford it. We should be talking about how can we not afford it. One of the things with us going to the UN is that we have no delusions that the UN will be helpful. But what we do plan on doing is making more awareness to the fact that the United States do not care about its citizens, and we want to be in community with folks who also have other inequities when it comes to health. And so let's talk, let's strategize, let's see what's working for you, what's not working for us. Let's see if we can collaborate. So we need to not just do it here, but also do it globally. We need to all unify, because I'm pretty sure even those systems that do have adequate care, it's not perfect, and we just need to talk about how we can improve that.
Okay, awesome. I think that's a great note to end on. Shareef, thank you so much for coming on this first little I guess it's going to be about a half hour podcast recording or video podcast recording I'll be uploading onto Substack. I'm going to stop the recording here in a second, Shareef. Don't hang up, because I do want to talk to you about a couple other ideas, you know, in terms of just, you know, strategizing and whatnot. Friends, thank you so much for listening to this podcast here on the Kennel. If you liked it, hit that like button. If you have any thoughts or any questions or whatever, you can hit that comment button. From time to time, I do read those comments. So please feel free to leave a comment, and feel free to share as well if you really like this. And also, if you want to see more stuff that I'll be coming out with, type in your email into that subscribe box, that subscribe text box, hit that subscribe button. You'll get an email notification for any new uploads onto the Kennel. Shareef, thank you so much, and have a good day, everyone.
Thank you.
So I just thought of this while processing the interview. I'm going to make an effort to record pre and post interview segments where I give expectations for the interview and then give my reflections on the interview, respectively. I didn't go into this interview with a lot of expectations, so that's why I didn't even really think to record like a pre-interview segment. I didn't even know his specific role at March for Medicare-For-All. Given that misunderstanding, I wish we could have talked more about his work at March for Medicare-For-All. I'm not going to lie, I actually sat on this interview for a couple of days because I was unsure of the level of his involvement in the organization. I didn't know like what role he was in, and I didn't really get that specified in the interview. So I'm glad I sat on this interview. That's one thing I'm focusing on here at the Kennel, is not rushing to upload just any content. After all, that's how I even got the idea to record this reaction segment, and that's how I ended up discovering a vital piece of missing info from the interview. Anyways, I found out days after the interview that our friend Mr. Snuggs is actually a co-founder of March for Medicare-For-All. So, knowing what we know about Shareef now, I first want to emphasize that the work he and others have done and continue to carry out seems pretty ambitious. I mean, a human rights violation complaint with the UN over our crappy healthcare system. I admit I don't know what their chances of success are. No, do I even know how frequently these violations are filed? I'm still unsure of the efficacy of this action, but what I like about it is it's showing that there are people on the left who are organizing, who are uniting on specific policy issues. But in terms of other things that I think I could have done with the interview, first off, I wish I would have pressed him about the chances of their success with this human rights violation complaint, and also how frequently those violations are filed, or those complaints are filed. But I also wish I pressed him more on the specific financial elements of Medicare-For-All. What I wanted to get that laid out, because I think Dan Whitfield succeeded in doing that when he appeared on Beast and Dragons in July. I'm going to splice in a little clip here for y'all to listen to. Yeah, so I did want to hop back, though, because you did mention about getting into how we're going to fund it, and that is a question I think a lot of people bring up whenever discussing a policy like that. How do you intend to fund healthcare for all?
Yeah, absolutely. So that's the biggest pushback I get, of course. How are we going to pay for it? Well, we are going to pay for it. They're correct. Nothing is free. But here's how we're going to pay for it. So currently, if you make less than $29,000 for your household income, it's not going to cost you anything. It'll be similar to Medicaid, except it's going to be more fully expansive. It's going to cover things like, vision, dental, hearing. It will also include a $200 a year prescription drug cost cap. So if you fill your first prescription in January and say, you're a type 1 diabetic and it's over $200, well, you would pay your $200, and for the rest of the year, your medications are at no cost to you. So now, if you're making more than $29,000 a year, I'll go ahead and use Arkansas as my example, as we're here in Arkansas. The average household income last year was $48,000. So you would take 48,000, subtract 29,000 because it's 4% after 29,000, which would leave you with $19,000, and 4% of that is about $760 a year, or $63 a month. So that's a bunch of numbers. Everything I'm saying, it is legit. This was a study performed by Yale University. But what it means is the average household in Arkansas, the average family, is only going to have to pay $63 a month to insure their entire family for medical, dental, vision, hearing, with no premiums, deductibles, or copays.
See, in that clip, Dan Whitfield laid out the specific financial costs that average American citizens are going to face under this proposed universal single-payer healthcare system. That's what I was trying to get at with Medicare-For-All. Now, I was talking with Dan after the interview over text, and he did tell me that essentially Healthcare-For-All and Medicare-For-All are basically the same policies. But I am going to try to hash out more of those specifics with him in a future podcast. That's right. I'm going to have Dan Whitfield on here hopefully sometime soon. I don't want to give away I don't want to set any specific days, because this is a thing that I'm kind of doing on the side while I'm doing schoolwork and prepping for LSATs and whatnot. But that is one thing that I am going to try to get hashed out in the future, are the specific financial differences, if there are any, between Medicare-For-All and Healthcare-For-All. Because I don't think Shareef answered that question. So I want to get that hashed out. I felt like Shareef certainly presented some valid arguments for a universal healthcare system. I think he has a good understanding of the inherent flaws of our for-profit healthcare system. So I think for that alone, I felt like it was he was absolutely worth having on the Kennel and sitting down to discuss with him. So I think for that alone, I think Shareef had some interesting perspectives and ideas to share. So yeah, I felt like overall I loved having Shareef on the podcast, and I look forward to having him on again with Dan Whitfield. So anyways, thank you so much for listening to, or watching, depending on how you're consuming this podcast. If you liked it, hit the like button. You want to comment on it. If you have any questions, feel free to hit them up in the comments as well. Also subscribe. That would be cool too, so you can get email notifications about the stuff I upload, so you won't miss a thing that comes out here on the Kennel. Thank you so much for watching or listening, or both, whatever way you feel is preferable. And have a good one, friends. Bye.